The first step in the ACS algorithm involves the patient, bystanders, and medical personnel recognizing the warning signs of cardiac ischemia.
We all had basic first aid training and CPR training about 6 months ago, and when Jack said his chest was hurting and his left arm was hurting, that's when the alarm bells went off for me.
Our system uses priority dispatching protocols, which help identify the problem and determine what type of response to send. What the caller described fit the protocol for ACS, which required a high priority EMS response.
While waiting for EMS to arrive, dispatchers may advise patients to chew 162 to 325 milligrams of non-enteric coated aspirin. This recommendation should be in line with approved medical protocols, and only if the patient has no history of true aspirin allergy or gastrointestinal bleeding.
Okay, paramedics are on their way. Stay on the line with me until they arrive. Do you have a first aid kit with you?
Yes, and I have our AED too.
Great. Is the patient still conscious?
Yes, he is.
Okay, then we won't need to use the AED right now. Ask if he has an aspirin allergy or any recent bleeding from his stomach.
Jack, do you have an allergy to aspirin?
No.
Have you had any bleeding in your stomach recently?
No, I don't think so. No.
No to both questions.
Look in the first aid kit. If it has aspirin, have him chew 2 to 4 baby aspirins or 1 adult aspirin while you wait for the paramedics to arrive.
That brings us to the next step in the ACS algorithm: assessment, care, and hospital preparation.
What happened?
He's been having chest pains for about 10 minutes, and the 911 operator said to give him an adult aspirin to chew.
Sir, how you feeling?
Not so good. It's my chest. I feel like somebody's squeezing it.
Okay, well, we're gonna help you out, reduce that pain. I'm gonna get a 12 lead. Go ahead and get his blood pressure and put him on a pulse ox. When we arrive on scene, the clock is ticking. I know I've got to assess, but if he doesn't need immediate resuscitation, my highest priority is to obtain a 12-lead ECG, manage the symptoms, initiate transport as soon as possible. Every minute matters. The longer it takes to get to the hospital, the poorer the outcome for the patient. In fact, half the people who die from ACS are dead before they even reach the hospital, so I follow the ACS algorithm closely just to make sure that doesn't happen.
Administer supplementary oxygen if the patient's oxygen saturation value is less than 90%. Give aspirin if the patient hasn't taken any yet and there are no contraindications. It's critical that out-of-hospital healthcare providers obtain a 12-lead electrocardiogram.
Looks like a STEMI.
This early ECG helps classify patients suspected of having an ACS into 2 groups based on ST segment deviation before they reach the hospital. It's preferred that patients with ST segment elevation be driven, if feasible, to a hospital that performs primary PCI. This initial ECG speeds the patient's diagnosis and shortens the time to reperfusion.
Recognizing ST segment elevation on a 12-lead ECG takes training and practice because different thresholds exist for patients depending on their age and gender.
If a STEMI is suspected, EMS should notify the hospital or transmit the ECG for interpretation.